Welcome to the Innovating Health podcast. This is your host, Hubert Zajicek. Hello and welcome to the Innovating Health podcast. My name is Hubert Zajicek and I'm your host. Today we're going to talk about 10 do's and don'ts of launching a health innovation related startup. Obviously, a lot of these things come up throughout the program here at Health Wildcatters, and I'm going to share out of that playbook today. And, having been in the healthcare startup ecosystem for 20 years almost in this role, I've seen a lot of a lot of stuff. But especially some things I want to share today, some things that you might want to seek out and do or get covered or get your blind spot covered that you might not have been aware of. And especially in healthcare, it's just so much more complex than in other areas. So let's dive right into it. We'll start with the do's. So I would be a bad salesman if I wouldn't say, do join a high quality healthcare startup accelerator. Now, I think in most cases, the startup people that join us are either first-time entrepreneurs, first-time healthcare entrepreneurs, or first-time to the US entrepreneurs. So that's the three groups. That said, we've had serial entrepreneurs join us. The reason why this is a good idea or why this is something you should consider is that you're plugging into a ready-made network that is just waiting for this type of opportunity. I mean, I'm not even kidding. They're waiting for you. The program starts, in our case, in September, and there are hundreds of mentors and investors that are engaged with us, meaningfully engaged. We're backed by over 150 angel investors and family offices. So meaningfully engaged. They're waiting to meet you. They're interested in what you're doing. They're ready to help you. That is like hard to explain how that can have an impact on you. But what I can guarantee you is it's not easy to replicate. Now, of course, you can build your own networks, and nothing we do here is magic, but it does happen in a much faster time frame. And like I said, these people are pre-screened to want to do this. And so that's something that I think you should think about it. And there's plenty of studies out there on success rates, and anyone getting into an accelerator that's competitive, and we would most certainly be along those, have a much higher success rate. So it's not always fair of who gets to be successful or not, because you need to raise capital and you need to do a lot of things right. But if somebody tells you that means well along the way, that goes a long way. So the second one would be to validate your innovation in healthcare. Conducting any kind of validation of what you're doing is not optional. Healthcare is complex and you need to understand all aspects of it. So the third one would be understand the regulatory pathway early. We deal with pharma companies, medical device companies, even health IT companies. And it is important for you to know and understand what your regulatory pathway might look like. And so understanding that early, again, you need friendlies that give you that kind of advice, that give you those insights, that help you understanding all those things. But it's not optional for you to at least try really, really hard on how to get those answers for those questions. We have the support of, for instance, Polsinelli, which is a law firm, and they've been incredibly helpful in a lot of these aspects because they too are very well connected. But whether it's your FDA approval, HIPAA compliance, or reimbursement strategies, you do need to get some regulatory help. Now, again, at the beginning, this could be informal. You just know that that's going to be you want to show up somewhere and say, we'll figure that out later. So having some sort of answer for that is important. Develop, number 4, a clear business model. Now, understand that may not be your final business model, but you got to be able to articulate and show that you've thought through a business model that you believe can work. So obviously, it could take many different ways. It could be direct sales. It could be an insurance reimbursement, partnership, licensing deals, depending on what type of startup you have, could be many, many different ways. But know that that's an extremely important thing, even if you change it. So you think that you might have to have the one and only, and the answer is, in the course of what we see in pre-seed, seed stage, and the startups that join us, a good number of them change their business model based on the inputs that they are receiving. And that's important because ultimately you want to get as close as possible something that you can execute on. So focus on your problem solution fit. Number 5, before scaling is important. You don't want to start building something out and then finding out that you can't actually scale with that. So you want to make sure that this isn't just some sort of niche product that fizzles out very quickly. So having thought this through is extremely important, which of course means you have to look at the markets and your customers in great detail. Number 6 is engage with providers and payers. So who is going to use your device, your IT, your drug? And that can be hospitals, physicians, insurance companies, and other key stakeholders in your ecosystem, depending on what type of startup you have. Getting access to these people is something you're going to be executing upon. You may know a ton of those people, but then you don't know the regulatory people. Well, this is kind of where having experienced people around you should help you a lot. Just know that is not optional. You will need to sell to these people, and if they don't, the first 5 you talk to don't like what you're doing, you're gonna be in a world of hurt pretty quick. And it's true too that you can have 2 physicians who love what you do, and they just happen to be the only 2 in all of Texas, for instance. So that happens as well. Number 7 is to build a strong clinical advisory board. Having reputable professionals in your industry that you can lean on is just incredibly important. It gives you credibility. It allows you to ask them questions. It gives you a basket of information that you have access to and people you can ping. And it gives you a lot of credibility. And by the way, I'm not saying that you can have all that at the beginning. You don't. You're just going to have that in the back of your mind and start working on building that up. 8 is a big one. That's securing non-dilutive funds and grants. So it could be STTR, BIR, other NIH funding. There are so many foundations. There are so many ways to get to non-dilutive capital. Investors love it when you do that. We also know it takes a long time. But if you just completely ignore it, I mean, there are some scenarios where you are going to ignore it because you have to be so fast and you don't have the bandwidth to deal with it. So there are exceptions, of course. But in general terms, it's a marathon, not a sprint. Your startup isn't a 1-year deal. It's more likely to be a 10-year deal plus. And that's the good news if it doesn't go under before then. So the odds are stacked against you. That's a reality. But no, it's a marathon. And so that means if you right now look at an SBIR and you think, oh, it'll be like 8 months before I find out if I got the money. Yeah, that might be true. You'll be also surprised how quick 8 months come around and how happy you are in 8 months and you receive an award. More importantly, investors love it. They appreciate that you are looking for other ways to bring additional funds in to help with the R&D of the startup. 9 is to show market traction and data-driven results. And that one is not easy to gin up out of nowhere, but investors really, really, really like to see some way for you to show that. Now, obviously, this isn't going to be applicable to all startups, but for instance, for a health IT startup, that would be an important thing. Even in a device, you can show that you've done some studies and you've shown some results, but specifically for health IT startups, you're going to want to be in that. And number 10, prepare for a long sales cycle. It is incredible how long it can take in healthcare to sell, even if you have a approved product that works, that people love, because there's so many layers of administration, reimbursement, and others to go through. That's why it's important to think about all of them as soon as you can and to get every one of those aspects covered so that you have an answer, you have an expert, you have some help in that particular domain too. We're going to go to the don'ts. I'll add a good one here. I'll add a bonus one here at the top for one AAA, and that is just don't be a jerk. You never know who you're running into that seems to be completely irrelevant to your venture. There's never an excuse to be a jackass. Before you know it, you have a VC meeting a year later, and that happens to be an analyst in that meeting. Just don't. Life's too short for that. Take a positive attitude. Treat all with respect. And I know this is a bonus one, so it's a softie, but still, I believe in that strongly, and you'll make a lot of friends. And like I said, it's a marathon, so don't be a jackass. But now let's start with the real ones. Don't ignore regulatory and compliance barriers. Don't skip that there is an FDA pathway you have to go through, that you have to deal with HIPAA compliance or cybersecurity. I promise this won't kind of just be all reverses from what I said earlier, but that's a good one to keep thinking about. We see that every now and then, that people say we'll figure it out later, and that's something you really need to pay attention to. Don't assume if we build it, they will come. That is not going to be the way it works. You need to work not in a vacuum. You need to work in an atmosphere where you get feedback from people all the time. And I hate to say it, but in almost no case is your thing so wonderful that nobody can live without it the next year. It just isn't. Good startups die for no reason. For no reason. It's not a fair process. Good ideas don't get executed or gone there. I mean, if you go to business school, you'll see tons of those examples of where the best technology didn't win, the best team didn't win, meaning technically educated or with the big degrees. So it's a much different game. So just be prepared for that. The third one is don't underestimate the complexity of healthcare. Not just the sales cycles, like I said earlier, but the complexity. You might have to talk to a dozen people before a hospital even looks at you. It helps to know and have an in with the right people, not an unfair in, just knowing who to even speak to. So I would encourage you to have somebody on board who's done sales, if that's what you're going to have in your startup. If it's like way off, then I suppose you can figure it out later, but it'd be good to know what you're getting yourself into. Number 4 is don't rely on a single funding source. I've seen it happen a handful of times. Of course, it's a wonderful event. It's like, oh my gosh, we can stop fundraising. So-and-so is going to take the whole round. It really is nice to have like at least 3 investors involved, or a dozen or half a dozen. That one investor becomes your sole lifeline. Everything depends on him or her or in that group. And then if you fall off favor or anything happens, that was your one investor. If you have a dozen, the other 11 don't exist to double down on you, even though number 1 investor isn't around anymore. It's hard to, I totally understand. I mean, it's hard to reject the money if somebody offers you the money, but go into it with a mindset that you want more than one investor. Also, this investor has way too much leverage over you, and you want a consortium of investors that help you and buy into the idea. So that's just a bit of a counterintuitive one, and extremely hard to deal with if you have the offer. So just ideally set out with the mindset that you want more than one. Don't ignore your reimbursement strategy. Sorry, but that's just the same thing applies as in the same sales cycles. If there isn't a code to pay for your thing or widget, it may get really, really difficult. And making your own isn't something you can just willy-nilly do. That takes time and effort as well. And so just take this as one of the core things you need to cover and not as a nice to have. Of course, we don't want you to scale too quickly. Number 6, without a market fit. I think that may be redundant. I think I mentioned that as a do. And don't neglect number 7, user feedback. So early user feedback is gold. Patients, users, potential users, to get as much feedback and information from them is critical, and I wouldn't want you to ignore any of that. Get as much as you can. It'll harden you. It'll make you better. It'll make your offering better. Number 8 is don't overlook the partnerships that incubators and accelerators can offer you. So apart from the mentors and the investors and all the cool stuff that happens, 100 events for you as a startup entrepreneur in 10, 12 weeks, 30, 40, 50 one-on-one mentor and investor meetings in that same time, and countless other interactions, including the whole peer group that you're working with. But don't underestimate the partnerships that are also in existence. Health Wildcatters, for instance, has a health investor alliance of almost 100 healthcare venture funds that we're partnered with. That's a very powerful thing. These will be eyeballs that will look at your deal when you are graduating. There are other partnerships. For instance, we have a sponsorship with a hospital group, Texas Health Resources. Well, these people are here. You can talk to them. You will gain invaluable insights, potential pilots, and other hospitals too, not just them. So just a lot of things floating around that are a huge advantage. And even if you're in the accelerator, some startups don't take advantage of those to the full effect that we think they should. An odd one you might not ever have considered, and I'll admit it's not going to be your first thought, is to not forget about your post-acquisition strategy. So this is the 9th point that I'm making here. But everyone focuses on the exit, but fail to plan how their solution will integrate into larger health systems afterwards. Now, obviously, you wouldn't have gotten a deal if you haven't gotten something to offer there. But I would suggest that you at least think this through and figure out what it takes. Very often a deal will be such that you have an earnout, or this is not an all-cash deal. And so the next steps are the execution. Well, if you haven't thought this through specifically and really, really are confident, a lot of your earnings, a lot of your windfall could then pulverize because you cannot post-acquisition execute on these milestones and you will fail. So this is something probably fewest of people think about, but it's extremely important because the exit often isn't the exit. It is a year, 2 years, or 3 years later. And there are conditions. And then lastly, 10 is don't lose sight of your mission and impact. It is about improving patient outcomes. If you keep that as your guiding principle, of course, you're going to have to make money. Of course, you're going to be excited about the numbers of monies that you will bring and what you can bring to your family as a result of building the startup. But what should drive you is the impact you can have on patients. And I know we can get jaded around that. You really can't be jaded around that in healthcare. I trained as a physician. Whatever happened in your life along the way, focus on that incident or some situation where you really desperately needed help and it was given to you in some way, form, or fashion. That is your mission, is to make lives better, to relieve suffering, and to bring a new healthcare solution to the market that has an impact on people. If it doesn't have an impact on people, it's not going to provide the value. And I think sometimes this can sustain you through the valleys, the times when things aren't going right, the times when things are desperate. If you have a mindset of, I'm doing this not just to have an exit, not just to build a company that's grandiose and big and famous, but I really want to have that impact on patients, you have a good guiding light that will help drive you along the way. So I wish you all the best in your endeavors. 10 do's and don'ts, plus the don't be a jerk as a bonus. And I hope to see you sometimes here at Health Wildcatters or somewhere else in the entrepreneurial ecosystem. Godspeed. Thank you for tuning in to today's episode of the Innovating Health podcast. Be sure to follow, give us 5 stars, and subscribe to stay updated to the latest cutting-edge innovations and revolutionary ideas shaping the future of healthcare.